Hello everybody. This talk is about an understanding between use of full cortical versus detailed anatomical vertebral models for preclinical assessment of spinal implants. Lower back pain comes with pain, muscle tension or stiffness. Pedicle screws offer better stability by connecting the fractured bones. There are two types of pedicle screws that you can observe here. The screws implanted in the spine in the first video is a normal traditional pedicle screw, whereas that in the second video is an expandable one. Earlier studies reported that expandable pedicle screws are advantageous over normal pedicle screws because of their good anchorage capacity. This study evaluated to understand whether a simplified full cortical model with only a material model of a cortical bone for the whole bony structure would be sufficient for preclinical assessment of spinal implants. In view of this, the manufacturer developed L4 and L5 vertebra were segmented into cortical and cancellous bone. Titanium rods and screws are implanted in the implanted models. Two different types of anatomical models, one with a detailed material modeling of bone and another a full cortical model was considered. Material models were chosen to be linear, elastic, isotropic. Ligaments were modeled as CGAP elements. 500 Newton compression with 10 Newton meter flexion and extension separately was applied on the superior bony end plate of L4 while arresting the degrees of freedom on inferior end plates of L5. Detailed model reported high strains with singularities on bone. Equivalent stress on screws was almost more than 7 times in the detailed model than in a full cortical model, although within the material limit of titanium. In conclusion, we can say that although detailed models provide better biomechanical insights, full cortical model might be used for a comparative assessment to reduce computational cost and minimize the strain singularities on softer cancellous bone. Thank you for your kind attention. For further information, you can scan the code or contact at the following address.